So if a woman presents with any of these classic symptoms, you are going to suspect endometriosis. Chronic pelvic pain, especially around the menstrual cycle, dysmenorrhea, which is painful period, dyspareunia, pain during intercourse, and dyschezia, painful bowel movements during menses. We are going to ask few questions before deciding the next step. First of all, you are going to ask, does she need a definite diagnosis? For example, if you ask her that does she need a definitive diagnosis, for example, she is having infertility or we need to rule out cancer, then you can ask that is there any concern for malignancy or adnexal mass? Then you can ask that does she have contraindications to hormonal therapy? For example, she can't take oral contraceptives due to clotting risk. Then you can ask, is she willing to try empiric or non-surgical therapy first? So you ask these few questions before deciding the next step. Let's suppose if she says no to these questions, like she's like there is no contraindication to the medical therapy, there is no need for the definite diagnosis, or she's not suspecting any cancer or malignancy or adnexal mass, and there is no history of infertility. So if her answer is no, that means that we do not urgently need surgery and there is no concern for cancer. So we can simply start with the medical or empiric therapy. You can give answers for pain control, plus you can give oral contraceptives to suppress the ovulation and endometrial proliferation. This is called the empiric therapy because you are treating based on the symptoms without confirming diagnosis surgically. Clear?
Okay.
If you have started this empiric therapy and the patient's symptoms are improved, you can continue the therapy. But if you have started the therapy and the patient's symptoms are still persistent, now you have to move towards the diagnostic laparoscopy. On the other hand, if the patient says yes to the answer, which means that she need a definite diagnosis or fertility evaluation, or you have concern about a mass, so the next step should be laparoscopy. During laparoscopy, you can visualize endometriotic lesion directly. You can excise or ablate them to relieve pain and improve the fertility. Clear?
Okay.
So, a few things you need to remember. The first line treatment, empirical treatment, medical treatment is NSAIDs plus OCPs.